My name is Michaela. I'm going to be your nurse today.
Okay.
We're going to be performing a cardiovascular and peripheral vascular assessment, okay?
Okay.
So I'm just going to start by asking you a few questions and then we'll move on to the assessment.
Alright.
Alright, can you tell me your name and date of birth?
Trevon Randall, 2006, April 12th.
Okay, and then what's your preferred language?
English.
Alright, and do you have any religious beliefs that I should know about?
No, you're fine.
Okay, and then at home, do you feel like you have a good support system?
Yes, definitely.
So if you ever were to need medications or be taken to a doctor's appointment, who would you turn to?
My mom and dad.
Your mom and dad? Okay. And then do you ever have any thoughts of killing yourself or hurting yourself or anyone else?
Heck no.
Okay. So patient looks appropriate for age. They are dressed appropriate for the weather. They are well groomed and there's no symptoms of anxiety. We're now going to move into the cardiovascular assessment. So do you have any shortness of breath?
No.
Do you have any chest pain?
Mm-mm.
Do you have any activity intolerance? Like, do you ever get tired when you're doing your activities of daily living?
No.
Do you ever have any problems with fainting?
No, never fainted.
And then do you ever feel like your chest or your heart flutters?
No.
Okay, all right. So now I'm going to inspect the patient. There's no diaphoresis present. I'm now going to look for cyanosis around the mouth. No cyanosis present. I'm now looking for cyanosis on the extremities. There's no cyanosis present. We're now going to move into assessing capillary refill. I'm going to assess capillary refill in all 10 fingers and all 10 toes. In the upper extremities, capillary refill is less than 3 seconds. Now on to the toes. In the toes, capillary refill is less than 3 seconds. I'm now going to assess the fingers for clubbing. There's no clubbing present. Okay, I'm just going to listen to your heart sounds, okay?
Mm-hmm.
So just relax for me. I'm going to start by listening to the aorta. Moving on to pulmonic. Down to the Erb's point. Tricuspid. And mitral. Okay. Heart sounds have a regular rhythm and rate. Sounds S1 and S2 are present in all 5 spots. We're now going to move on to the peripheral vascular assessment. Do you have any pain in your calves?
No.
And do you have any pain with walking?
No.
All right. I'm now going to assess for any edema, starting with the bony prominences at the knees and working my way down. Assessing for edema bilaterally over all bony prominences. All right. There's no edema present. When inspecting the skin color, it looks appropriate for the rest of the body. There's no discoloration, and hair is evenly distributed on both extremities, signifying great blood flow. I'm now going to assess the radial pulses bilaterally. Radial pulses are equal bilateral on both extremities and they're strong. Now moving on to the pedal pulses. I'm assessing these bilaterally as well. Pedal pulses are present bilaterally and they are strong. And this concludes my assessment.